Good morning, friends. On behalf of CAHO, I extend a very warm welcome to all the participants for the CQE series, which is the Continuing Quality Education series of CAHO. And this time we have the online workshop on waste management in healthcare facilities. So this is an initiative by the Quality Professionals Division of CAHO, and I extend my welcome and thanks to the organizing chairperson of the Quality Professionals Division, Dr. Anuradha Pichumani, Dr. Suvin Shetty, and Dr. Anna George for gracefully agreeing and accepting our request to give us this day that they generally host the Continuing Quality Education series, to gracefully agree to allow us to use this day for conducting this very important workshop, the online workshop on waste management in healthcare facilities. I welcome all our organizing secretaries for this workshop. Dr. Jayalakshmi is not able to join us, Dr. Ritu Gar, the conveners, Dr. Malti, Dr. Deepthi Madhu, and all the speakers for this wonderful workshop. My welcome, I extend a very warm welcome to Anu Agarwal from WHO, Dr. Aruna Pujari, Mr. Nathan, Mr. Vinod Kumar, Dr. Deepthi Madhu, Dr. Anil Kumar Chilimunta, Hema Paul. We have Dr. Ritu Garg also as a speaker, Dr. R.C. Biloria, and our own Dr. Sashank. Thank you very much for accepting our invitation and for being with us. This is an 8-hour workshop from morning 9:30 onwards. And a big thanks to both the centers, CMC Vellore and AIMS Mohali, for gracefully agreeing to be part of this project and for accepting our invitation to be part of this program. I invite and welcome Dr. Vikram Matthews, Director CMC Vellore, and Dr. Bhavani Bharti, the Director Principal, Dr. B.R. Ambedkar State Institute of Medical Sciences, Mohali. These are the two institutions that have agreed to partner with us as part of this project. So what is this project all about? This is a project with WHO India on assessing, brainstorming, and documenting issues and challenges faced by healthcare facilities with respect to biomedical waste management in the country and to aid compliance. And the first aim was to organize about 5 regional workshops. And this has been conducted very successfully. And thanks to the team of faculty who went around to the 5 regional centers and conducted the workshop. We have excellent feedback from all the participants, and we have about 350 participants who attended the 5 regional workshops. Documenting the ground level issues in each region and compiling a regional status report covering all the areas and submitting that to WHO India. We've had several rounds of focus group discussions as part of the regional workshops. We've also conducted a survey, requested in hospitals to conduct the survey, and that compliance report has also come to us. The third objective has been setting up model waste management systems in 2 medical college hospitals and documenting the challenges and opportunities for biomedical waste management implementation. And there's 2 centers, CMC Vellore and AIMS Mohali, have really permitted us to do this. And we are working very closely with the teams in both the hospitals to setting up both the centers as model centers. And the aim is also developing them as training hubs for the respective states. So with that, I really thank all of you for joining this session today. I'm sure this is going to be a very useful session. We will have a pre-test, we will have a post-test, and we have more than 1,500 participants, and I'm sure they'll all be joining us. I now hand over to Dr. Aruna Pujari to take over the session. Over to you, Dr. Aruna.
Thank you, ma'am. Very good morning to everyone. I have the honor of introducing our guests of honors, Dr. Vikram Matthews, sir. He is a hematologist by profession and has been involved in research and management of patients with leukemia for the last 20 years. Sir is currently the director of the prestigious institute, Christian Medical College, Vellore, which has recently expanded its new campus at Ranipet. Sir has been at various roles in different administrative bodies over the last 20 years, contributing to major changes in improving the quality of patient care at CMC Vellore. Requesting Vikram Matthews, sir, to please say a few words. Thank you.
Thank you. Thank you so much, Dr. Aruna Pujari, for having me. I hope you can hear me clearly. Also, morning to the WHO representative, Anu Agarwal, and want to start by thanking CAHO and WHO for collaborating these kind of workshops. Truly honored to be here. Waste management in hospitals is a critical issue that affects all of us. It has far-reaching implications for our health, environment, our communities, way beyond just the hospital. And we cannot leave this to chance. This is something that needs structure and organization and harmonization across different states in a vast country like us. And often, while we want to comply, we find that there are so many hurdles and different perceptions of how certain things should be done. So these kind of workshops, I'm sure, will go a long way in harmonizing practices, which are good for all of us. Biomedical waste comprises a wide range of items from used needles, syringes to contaminated dressings, expired medication, and even radioactive material. Improper handling and disposal of biomedical waste can lead to severe consequences, including the spread of infections, harm to the environment, and contamination of water sources. As per the 2021 annual report of the Center for Pollution Control Board, the total quantum of biomedical waste, this was in the era of the COVID, was 774 tons per day. And they noted that 656 tons per day was non-COVID and 180 tons per day was COVID biomedical waste. There are almost 352,000 healthcare facilities, of which a third are bedded and two-thirds are not bedded. So you can just visualize and imagine the amount of waste that is produced per day. It's estimated this runs into more than 1.5 lakhs, close to 2 lakh tons per day. Some data that a lot of it is actually collected efficiently. How it is disposed is a matter of concern in certain quarters at least. It is crucial for us to recognize that healthcare facilities, whether large or small, generate a significant amount of such waste. And as the healthcare sector continues to grow and evolve, so does the volume of waste it generates. There is often lack of transparent guidelines with regards to liquid waste management, especially something that concerns me as I work with the lab, etc., is at least what we hear about many material being discarded directly into the sewage lines and, creating potential dangers, including biohazard materials like radioactive materials, etc., which to really set up the infrastructure to do with that is not often easy. So these are some things that needs transparency with regards to what the guidelines are, how people should comply with them, and also be practical and pragmatic to the realities and ground realities of India, and not just have rules and regulations that are impractical and not actually doable in many parts of the country. So I think some amount of innovation is required for a country like ours, and a copy-paste job from the West is not something that's going to work for us. We really need to build our own guidelines, keeping, of course, patient safety and our environment and the safety of our country at foremost without any compromise. And I think that those are they're not opposite ends of an oxymoron. They're certainly doable and can go hand in hand. It needs intelligence. It needs people and communities to come together to see how we can address it. Major challenges are faced in the final treatment facilities. It's estimated that there are almost 45,000 healthcare facilities that use common bio-waste handling facilities for collection and treatment. And 17,000 are having their own captive biomedical waste treatment and disposal facilities. There were almost 200 such central biomedical waste handling facilities in the country. 33 are under construction, another 33 are construction. Many states do not have such centralized facilities for treatment and disposal of biomedical waste. And this is something that needs to be looked at very closely in terms of a regional hub and spoke kind of model that deals with waste, so that there is both expertise and facilities in hubs that can cater to spokes around those hubs, and not have large tracts that are not covered by these kind of regulations. I really want to congratulate WHO and CAHO for coming together for this collaborative effort on bringing participants together to learn from the experts. This workshop aims to shed light on the best practices in biomedical waste management. It provides a platform for us to exchange knowledge, share experiences, and learn from the experts who have been at the forefront of this field. Together, we can develop solutions that are not only address the immediate challenges, but also create a sustainable future for our healthcare waste management. To conclude, I believe that by coming together in forums like this, we can lead to safer healthcare facilities, a healthier environment, and a more sustainable future for the generations to come. I want to express my thanks to the speakers and participants and organizers. And as was already stated before, CAHO is really a live bio kind of organization run by volunteers. Essentially, their enthusiasm. I wish I could somehow recreate that in CMC. It's not easy to get people to be enthusiastic around common goals. So there's something to learn from you all. Let us engage in meaningful discussion, share our insights, and forge partnerships that will contribute to a cleaner, safer, and healthier world. Thank you, and I wish you all a very productive and enlightening workshop. Good night.
Thank you very much, sir, for enlightening all of us on the problem statement of biomedical waste management in the country, giving us some suggestions and also some motivating words to work better in the future.
Now, we have with us Dr. Bhavneet Bharti. Ma'am, she's here to share with us a few words on her take. As an introduction, as already Aruna ma'am has introduced her, I'll just say a few words about her. Bhavneet Bharti ma'am has a vast experience of 21 years. She has been working as a faculty in the Department of Pediatrics at the prestigious Postgraduate Institute of Medical Education and Research, Chandigarh. And Madam has been appointed as Director Principal at Dr. Ambedkar Institute of Medical Sciences at Mohali. And she has done her diplomate in Environment and Child Health from WHO and American Academy of Pediatrics with a vast bulk of publications in indexed and non-indexed journals. Madam is here to share with us a few words on the topic.
Thank you, Smriti. I'm sorry, which I could not join earlier, but what I feel is this topic, even if we do it almost every few days, every time we have something new to and some new questions coming up, just like Anu was sharing just now, spill and clean, clean and spill, the new evidence is constantly emerging. And working in constrained environments, we always find it difficult, and we find that we really need to work for the patient safety and make sure. And currently our institute is also part of the program, the WHO program, where we're working out. In fact, our team we have 67 points in our hospital, and we're really making effort. In the last few months, we had an administrative duty roster where we actually said any violation to be reported in the administrative duty roster. And first 3 times, we are just going and explaining, trying to identify the issues with them. And I said, once we have optimized and taken care of all the concerns, and when we feel that it is only when they do not do, once they have been fully made aware, that is the time we have said a show cause notice. Another NMC actually asked us to do a best department competition. In that also yesterday, when we had that best department competition, one of the important points, in fact, 20 points we had given to biomedical waste. One was a surprise inspection. And second was that during the period of last 3 months, how the department fared as far as the biomedical waste violations was concerned. I think that made it clear to everybody that this is something which cannot be overlooked. It is a statutory requirement, and it has an important implications for safety of both the patients and including the others, even in the community, who are at risk because of our behaviors. So I think biomedical waste is one of the important part for patient safety. So thanks to CAO and the WHO, which is working on and actually building the capacity of my institute, including the various people. So thanks a lot. Thanks, everybody. And we feel proud to be associated with you. Thank you. Thank you. Thank you.
Everyone. And of course, the great initiative of WHO and CAHO for bringing a focus on this biomedical waste. So Anu Agarwal gave a very nice talk just now, and she was referring to some historical aspects. So I was a part of the history of some of the biomedical waste thing in the country. So I wanted to bring a little bit of correction in the historical aspect of this. So one thing is that the biomedical waste movement in our country is linked to a court judgment. And therefore, I think all of you can probably, will not probably have heard of it. So it was one Dr. B.L. Vadhera versus the Union of India. This was a court case where Mr. Kuldeep Singh was the judge. who gave an order in 1996 ordering every nursing home which was more than 30 bed in the city of Delhi to install an incinerator. So the first biomedical waste rules came in the form of a high court judgment. And at that time, I was leading at that time a kind of an institutional group in Delhi. So we had gone against the order. In fact, at that time, where Anu was working with a very important organization, Toxic Links, his director Ravi Agarwal and us, we were tried to understand the dangers associated with this indiscriminate incineration. And that is how we had gone also to the court, and that is also on record. And that's where the court had then directed the Ministry of Environment and Forest to come out with the rules. So besides the international pressure and those signing, I think the immediate trigger was this court. And therefore, all of you can please refer to this court judgment, which is in 1996, Kuldeep Singh bench, and it was B.L. Vadhera versus the Union of India. Just to put the historical perspective, I will say. Thank you. Thank you very much.
Thank you so much, Vijay Agarwal, sir. We can always count on you to bring in some light, shed some light on what has happened, even beyond the books, some things that we can get to know only through you. So thank you for shedding that, giving us that light, that illumination on what exactly brought about all this. I was also wondering why did things suddenly start off in 1998? What happened before that? So thank you so much for bringing a fresh, whole new perspective.
Anu will remember this.
I want to raise one thing. Actually, Dr. B.L. Vadhera took up the 96 draft rule, and he said that this rule is not being implemented in Delhi. So he just said that the draft rule has to be implemented in Delhi, and the draft rule said all 30 bedded and above incinerators hospitals should have an incinerator.
No, Anu, let me bring out that correction. Please understand. In 1996, there were no draft rules. This was the court judgment of Mr. Kuldeep Singh. He came out with a judgment based on some advice given to them at that time by CPCB. There were no rules in the country, and this was the case. Go through this case. This is the Union of India versus Dr. B.L. Vadhera. And it was not that
we took it to the court. We took it to the Supreme Court.
Yes,
RBI was in the Supreme Court against this judgment.
Yes, I was there at that time, and it was Ravi Agarwal who brought to our notice that if you follow the advice of this court, of the Supreme Court judgment of Kuldeep Singh, you will do more damage to the environment than you will do any help. And that is where then the court came up with that you can follow incinerator / non-incinerator technology to handle it, and ordering the Ministry of Environment and Forest to come out with the rules. And that is where we were a part of, in fact, the first committee of the Ministry of Environment and Forest, which made the rules. So all this has happened in 1998 as the form of the first rules. Initially, it was the court's order that were being followed or not followed. So, I mean, please go through this judgment. It will be very, very enlightening. That's all I'm saying.
We shall, I think more than one of us would be definitely going through that judgment, sir, because understanding the history is important to understand what is going on right now. So thank you so much for enlightening us and sharing with us that particular part of the history of biomedical waste rules. So thank you so much, sir. And thank you so much, Bhavneet Bharti ma'am, for sharing with us a few words on what has been happening in the past few days and how much of impact our programs have been having. So thank you so much for sparing the time to share a few words with us, ma'am.
Thank you. Thank you.